all the complaints are because of the nervous system. All the complaints are due to the nervous exertion or exertion or cerebral exertion. Person is suffering from nervous or cerebral congestion, we will think about zincum. That is the important point we have to remember. So zincum, we have to remember that zincummet is proved by Dr. Hahnemann. Dr. Hahnemann is our prover, and regarding other that Dr. Hahnemann is prover, and it is belongs to the miasmatic, that is Sora is predominant. Sora is the predominant miasm, that is Sora is the important. So if we go towards the constitution of the zincum, that is all the complaints are coming from the cerebral or nervous system exertion. Nervous system exertion, we are thinking about zincummet. Person suffering from cerebral or nervous exertion defective vitality, mainly due to the brain or nerve power dysfunction or exertion. There will all complaints are whether the normal discharge, means the menstrual function is deranged, the cough expectoration is deranged, the urination is deranged, the comprehension power of the child is deranged, the memorization occur also derangement. So only you have to remember in the constitution, the nervous and the cerebral exertion causes the all type of a derangement in the person. So zincum is not able to do any works, normal day-to-day works. Then we go to physical journal, then we will start with the physical journal, then we will tell the mind symptom of the children. So physical is mainly the children, the hunger mainly if we call that hunger is which type of hunger is like canine hunger, like sulfur. So sulfur in timing and lycopodium in if we tell that sulfur timing and lycopodium nature. So sulfur time, that is 11 to 12 am, sulfur having 11 pm. Here it is not am, you should change it into pm. So 11 pm and or not or it is 11 to 12. Then great greediness, like lyco, they have the greediness to eating but cannot eat fast enough. That is the important mark point you should remember about your physical journal. Then what about the other things, that is feet, sweat and sore about the toes, fetid smell, foot sweat is fetid and great nervousness. Like nox vomica, every stage of the heat, fever, heat, chill, rigor, all the stage he wants covering. But here we can say that the zincum does not record any type of a covering, means in the children they have the mental and nervous system congestion or deformity. So they have the mentally, child is what, they are irritated or mentally little idiocy, like ADHD, mental problem they have. So child memory also get decrease of that spinal or nervous affection. So child get everything, repeats everything whatever the things we said for the child. Then we go towards the physical. Now I just revised the constitution is everything is deranged because of the cerebral and nervous system exertion. That's why everything is deranged. Then mind, if we call mind the child, because of the hydrocephalus condition, which we later study that why hydrocephalus condition happen, because the cerebral system becomes exertion. So the in the cerebral ventricle is there. So in ventricle there will be, when there will be what happen in ventricle, there will be liquid is means water get accumulated. Like in the nervous system you will see that there will be cerebral affection, means inside the cerebrum there will be ventricle, in the ventricle there will be liquid fluid accumulation which causes effusion like symptoms in the ventricle. So child becomes hydrocephalic condition, means here it is called brain vis medicates nature, means hydrocephalus condition. Develop example like cupromet, sulfur, tuberculinum. You can remember these three drugs along with your zincum, the xanthematic condition. So child became restless, child become mentally idiotic. So they repeat everything whatever the child we say, they repeat. Then urinary, like meadow, like your causticum. In meadow what happen? In sitting back or bent, there will be stool happen. In meadow there will be stool occur because of a sitting back position. In causticum there will be standing up position, there will be urination happen. So you can remember like CSU in the mnemonic. Then female is that everything is feels better when there will be like sora. I tell previously the miasm is sora, so all the complaints are seizures or complaints are go down as soon as the menses happen. So menses when happen, all the feels better every way as menses begin to flow, and when the suffering and relieves all the physical suffering, and when the menses ceases, the again the suffering is started. Then back, in back part what you remember? So in back you always remember the thing is that there will be spinal affection is there. I told before that there will be cerebral and nervous system is affection. So nervous there will be spinal thing is there. So in spinal there will be burning sensation along the length of the spine. You can remember by Rostock's pulsatilla, there are backache much like that you can remember. So here it is a cobaltum also like that you can remember by this way, that cobaltum also aggravation when sitting. Thus back pain will be happen more in cobaltum when sitting is there. And pulsatilla Rostock's you should remember, because in Rostock's and pulsatilla their drug picture it is not present, but here it is written. And clinically also we give in burning sore sensation in the spinal system, means patient tell that in clinic that whenever I am sitting there is a sore burning sensation I am feel in the back part of the spine. So we can think about Rostock's like that. In zincummet bracket is written. Then spinal irritation, spinal prostration, strength is get down, cannot bear the back to be touched, like tarantula, like theridion, like chinnum sharp, like zincum. Another one is your lobelia also spine is so sensitive, cannot bear the cloth of the dress or whatever the things he wear, he cannot bear. That is the important point you have to remember. Then last is the extremity, which is commonly asked in the children part, that they are having the excessive nervous fidgetity. Important is the in the extremity there is a fidgetity is the important point. You have to remember this fidgetity point. Why? Because without fidgetity the zincummet is incomplete. Fidgetity on the lower part, fidgetity we can compare like that way. Fidgetity in the, you can say graphitis, there will be in graphitis you can see, you can find there will be okay. In graphitis the fidgetity while working, that is the things. In graphitis you get the fidgetity when sitting position. When sitting, graphitis have the fidgetity. And your another fidgetity is phosphorus, and another is agaricus. Another is your agaricus, there will be prolapse, menstrual complaint, all are complaint with the fidgetity. Phosphorus and calibrum, KBR calibrum, you can remember like that way, that what are the fidgetity drugs are there. So excessively fidgetity, cannot move the leg, and weakness, extremity while writing or during menses period, you have to remember. I just write but it is not removing, sorry ma. Okay. Then nervous important is that there will be cerebral affection, which I told. Paralysis of the brain occur in the children, there will be zincummet children can be asked. So you can remember that way. The causation is the cerebral effusion happen in the ventricle of the cerebrum. Child cries during sleep, whole body is a jerk during sleep, wakes frightened and rolls, like all those things are written in belladonna. Like belladonna you can remember here, like belladonna there will be rolls head side to side, face is pale and red, child is cries out, cannot sleep, wake in the fright like aconite. You can remember 4 drugs of cerebral paralysis or cerebral congestion: aconite, belladonna, convulsion happen, convulsion, aconite, belladonna, your zincummet, your you will remember the convulsion, hellivorous is there. There are many drugs are there, so you can remember this 4-5 convulsion during dentition. There will be face become pale, but there will be no heat. You always remember there will be reverse of belladonna. Why it is written? Because belladonna like symptom, but at belladonna there is fever is present, but zincummet fever is not present. That is the difference. Like aconite, it having brightness symptom. Aconite there will be gnashes of the teeth, like gnawing of the teeth. Here zincummet also like that only happen. Like brownia, like helleborus, there will be one hand, one same side automatic motion occur. Like your zincummet, 5 drugs you remember: apocyanum, brownia, helleborus, zincummet. 4 drugs you should remember. Examiner always asked these things. Then chorea, mainly suppressed eruption or fright. Okay, suppressed eruption you can remember the soranum. Your soranum is there. Suppressed eruption there will be soranum is there. Dulcamara is there, agaricus is there, PDA, sulfur is there, tuberculinum is there, PDAS. So that is chorea from suppressed eruption. Twitching and jerking like agaricus, ignacia, you have the twitching jerking movement is there. Like agaricus in your ignacia is there. There are so many drugs are there. Crocus sativus is there. You can remember Crocus sativus. There will be twitching and jerking. Crocus sativus, yes, Crocus sativus is there. Okay, twitching of the single part, twitching of the. So you should remember that thing. And then like in lyco there will be appetite. Like in sulfur there will be timing. I told before. And the skin there will be rubbing, emulation the skin complaint because it is a cold. Hot patient, so light for cold. So all many complain drinking wine. Here wine, another drug you can remember arnica. Aggravation by wine, that is arnica. Okay, and emulation by chest or expectoration of the bladder or urinating, like copertum emission happen. Emission occur, it is emulation. Menstrual flow is emulation. Inimical is chamomile and oxymel mainly commonly used. Chamomile and oxymel cannot be given before and after of a zincummet. Thank you.